Hey, I have Scott Harrelson here with me, Craven County Health Department in Craven County, North Carolina. Scott's the CEO. And Scott, thank you for sitting here with me just for a few minutes. I know we both are running pretty crazy right now. Couple questions. Number one, could you tell us what were the main drivers for you in deciding to obviously go out and purchase a population health technology platform?
Yeah, we were really in a predicament. Our EMR, they tried for about 6 years to be able to pull UDS data, because in addition to being a health department, we're also a federally qualified health center. We're a dual entity. And these UDS reports eluded them, and we started looking at other EMR options. And we found that the quotes we were receiving were about 5 times more expensive than what we were paying. And then I would follow up and contact some other FQHCs that were using them as well, and found out that they were none too happy with them either, and they were actually looking for another EMR themselves. So we heard through our primary care association in North Carolina there was some grant funding available, and we were able to meet you guys with i2i. And then you began to work on those reports, and shortly we were no longer having to do these laborious chart audits, and instead of seeing our data at the end of the year, now we can see it throughout the year to find where we're at. So it's been a game changer for us. And even with our current EMR and the cost of i2i, it's still much less expensive for us than what we were getting these quotes from, because they were looking at every visit. And when you pull in the health department visits like maternity, STD, family planning, communicable disease, a lot of them we do not receive reimbursement for, but they still up the rate for the calculations that go into what we're receiving.
Got it. Yeah, you guys are in a unique situation with a federally qualified health center and a health department. Double the pain points in a lot of circumstances. So you mentioned some great things. What are some of the huge value points for you that i2i is helping you with?
Well, clinically, pragmatically, my clinic staff love the huddle report. You know, it puts everything in one place. So functionally, each day of the clinic, that's one thing I'm hearing from them. Then we also started thinking, well, if we can pull these data points out for the UDS reports for the FQHC, couldn't we do the same thing on the public health side? And that is where we're really lacking. And I think not only in North Carolina, I think that's probably commonplace across the country. And so we've been having these old federal grant programs that we've been doing for years, but honestly, right now, we don't even have a good methodology to tell you across the state how many people we're seeing. In Craven County, I can give you good data, but statewide, if decision makers will be able to say, how many people did you serve last year? We can't really give them a good answer because our current reporting mechanism is double data entry. Sometimes it gets done, sometimes it doesn't, sometimes it's not done correctly. There's no continuity. So we were really looking for something like i2i that could work with the various EMRs that health departments use across the state. No double data entry. It could be easy. It's extracted. And then the other thing is our statistical data is usually 3-4 years old.
Gotcha.
By the time the reports come out, we found out this is like a daily upload.
Yep.
I mean, at the very least, you could have it monthly if you wanted to look at that kind of frequency. Then if you want to improve your quality, you got to have routine reporting. You don't have that, you can't improve your quality.
Right.
So this does a lot of things for us that we think once we bring more health departments on board, then we'll have, if not all of them, at least a good representative sampling. And then we can start even establishing some of these baselines for the HEDIS measures. The HEDIS measures for these programs were out there. We just had to kind of put them in place. And then, we'll know kind of where we're at as a state, hopefully improve our game over time, and then also have some good data to sit down with legislators and county commissioners and county managers. And that kind of takes your program planning out of assumptions, and you're actually using data, and you're not using a representative sampling from some laborious chart audit.
Right.
But you got it in total, and you got it almost in real time.
That's great. Thank you, Scott, for taking time. Appreciate it.
Yes, sir.